The United States has reached a milestone in the fight against coronavirus. Vaccines have been approved and are now being distributed to healthcare workers right here in Colorado. We know many of you have questions about the vaccine, so to help get those questions answered is CBS4 Medical Editor Dr. Dave Hnida. And Dr. Dave, we've seen a vaccine get developed so quickly, so the big question is it safe?
You know, it's amazing. We look at this and you got to think, boy, they sure had to cut corners here. But I think really what happened is they really didn't cut corners. They were able to cut red tape, and they were also able to use technology that really was not present 10 years ago. You know, it used to be that when a vaccine would be developed, it would take anywhere from 5 to 50 years in order to use some of the older technologies. But within the last 10 years or so, we've had the development of this great new technology, which really allows us to develop vaccines very, very quickly. It is basically the equivalent of looking at technology that's like a Model T Ford and what's on a space shuttle. It is just a tremendous amount of progress within a short period of time. We're now talking about things like messenger RNA and spike proteins and genetics and genomes when it comes to vaccine development these days. And these are concepts that weren't even available in the year 2000, for example. So we've had this new disease come along, and fortunately with the new technology, they literally have been able to take the genetic code from coronavirus and plug it into the new technology, literally within a test tube, and therefore enable it to swirl up and do its thing, and then wind up resulting in a vaccine that is considered to be safe and effective. Now, before you make that determination that it's safe and effective, you go through all of the phases of testing. You test different amounts of people, you then increase those numbers of people, different age groups, different medical conditions, and so forth, and you make sure that it is, in fact, safe and effective. The manufacturer winds up presenting the information after reviewing it to make sure that it is successful. It then gets reviewed by an independent policy team, which will look at the data and has looked at the data and says, yes, it is safe and effective. It then goes to the FDA, where several layers within the FDA wind up doing a review. They then send it on to the CDC, who independently winds up looking at it one more time to make sure that the recommendations seem to be in order. And then they do make the recommendation for an emergency use authorization. I have to tell you that if discussing this 3 months ago, 4 months ago, personally, I think I had a little bit of qualms at how fast things were moving, a little bit concerned that there was too much politicalization of the process. But I really feel confident in terms of how this vaccine has been developed and how safe it is and how effective it is. And I think that I can confidently say to everyone that when my turn comes to get the vaccine, I will be rolling up my sleeve and taking it without concern, and actually be very happy to be protected from COVID.
Very interesting. The technology aspect is something I think a lot of people haven't thought about. Very, very good information. Our second question is, who cannot get the vaccine?
Well, I think first of all, you've got to take a look at where you are in line. You know, right now we're doing frontline healthcare workers who have direct contact with COVID patients. If you are an essential worker, if you're a member of the just general population, you can't skip through the line and get your vaccine sooner than what the current program is designed to allow you to get it. And so I think number one, when your turn comes, that's when you'll be able to get it. I think when you take a look at the medical aspect of it, there are a couple of issues, and you have to take a look, number one, that it really has not been tested in children. So we really can't comfortably say that it's okay for younger children, for example, to go ahead and get the vaccination. Right now, testing is underway for younger children, so that is good news. The bigger concerns, though, revolve around some recent events. the vaccine just started being administered in England, and there were 2 cases of very serious allergic reactions. So right now, a lot of people are just going, oh man, you're going to wind up having this anaphylactic reaction where your throat closes up and everything swells. Reminder, it's 2 cases, and we do think that these were individuals who were the type of people who were just hypersensitive to something within the vaccine, not the actual vaccine material, but the vehicle, the liquid in which it was contained, and that the people were successfully taken care of. These are the kind of people who have the type of allergies so severe that they are walking around all the time, 24 hours a day, 7 days a week, with EpiPens, epinephrine, to inject themselves if they would have a reaction. The general consensus is that even though a lot of people do have sensitivities to medication, to food, they will be in generally a safe place when it comes to vaccination. But it is something that certainly needs to be discussed and brought up if you have a history of severe allergic reactions to either food, medications, or anything else that you could possibly be exposed to. And you need to be prepared, as the facilities that are administering the vaccine will be prepared in case there is a problem. Another big group we need to talk about are pregnant women and women who are nursing. There are thousands and thousands of frontline healthcare workers right now who are having to make the decision, do I wind up getting the vaccine here at the very beginning of vaccine rollout? And even though there was not testing of people who are pregnant or people who are nursing within the trials, it is felt that, like most vaccines, this vaccine is okay to use if you are pregnant or you are nursing. And I think that there's a long history of, once again, vaccine safety, and the big issue really boils down to the severity of how hard, for example, COVID hits a pregnant woman and places her at risk, as well as her child at risk. So it is an individual decision. It's something that needs to be discussed with a physician or provider in order to make the decision of whether or not you comfortably go forward. Within my own family, myself and someone else, my daughter, we're frontline healthcare workers, so we have to make that decision. Do we wind up getting vaccinated with underlying medical issues or other concerns going on? And so these are things that are being discussed. And it really does bring up the very important point of make sure you have a primary care provider, a primary care physician, someone who can advise you when you have a situation pop up. Everyone is different when it comes to their medical situation and their ability to receive a vaccine. We think that the vast majority of people are going to be able to get vaccinated, and therefore we will wind up hitting a point where we will have a normalization of things as we go into late summer, early fall next year, hopefully.
Very interesting. That's definitely the hope. If you've already had COVID, do you still need to get vaccinated?
I think 3 answers to that. It's yes, yes, and yes. It is something where we do not know, even if you've had COVID, a mild case, an asymptomatic case, a very severe case, just what sort of antibody protection you have against COVID. And even if you did have antibody protection, how long does that antibody protection last? We do know that getting vaccinated is the safest way to go, because we know that we can make sure that you have a good immune response if you are exposed to the virus, and you have an excellent chance of fighting off the disease. And you'll say, well, wait, I've already had it. Well, we do know that there have been cases of people who have been infected again. We know that people have tested positive again, even though they're not sick, after getting COVID. And so we really have a lot of uncertainties in that line of thinking. So the best advice is, yes, you need to be vaccinated. And even after vaccination, you need to continue to practice social distancing, wear a mask, practice good hygiene, so on and so forth. We really do think that, it is vitally important that safety measures continue to be followed, because it's going to take a long time for us to get this rollout of vaccinations done, and a long time before we are able to protect our full population and achieve the so-called herd immunity. But there is, once again, light at the end of a very long tunnel, which is really good to see for a change.
I had a feeling your answer was going to be yes to that. Dr. Dave, thank you so much for all of your helpful insight, and we'll continue to get those coronavirus and vaccine questions answered every week right here on CBSN Denver. We'll be right back.